Hi, my name is Arieta. I'm from the Fiji Islands. I was diagnosed as having artery problems, and my doctors back home in Fiji recommended that I seek medical attention that can help in a way a variety of procedures rather than just the traditional procedures. So I checked out what was available. Helped me research. We linked up with the Apollo officer who sent us a flyer on the services that they offered and the doctors. I realized that the robotic surgery was also available. I reached out to Dr. Varun Bansal.
Miss Rita is a 59-year-old gentle lady who came to us with history of coronary artery disease. Surprisingly, she was asymptomatic. She never had any symptoms. And when we evaluated her and looked at her angiogram, it was found that she had a very challenging anatomy. One of the arteries was completely occluded. The other two had significant critical diseases. We discussed with her family, herself, and a cardiologist regarding the challenging coronary anatomy she had, and we offered her a hybrid coronary revascularization procedure.
A couple of options were available to me that was explained to me on my first day. There were 3 options, and between me and my husband, they were explained to us and we were asked to pick a choice. And without thinking, we picked the hybrid choice.
In hybrid coronary revascularization, in first stage, the CABG is done using the robotic system, where the patient does not get too many cuts. The chest bone does not need to be opened. We made 2 holes here and took out this artery from the chest and did her 1 single bypass Lima to LAD. She recovered very well. On day 1, she started walking in the ICU.
The robotic surgery was performed by Dr. Varun Bansal. He was the lead in the procedure, and that went very well. Within a day, I was awake, doing my exercises.
So the patient main vessel, which is 100% blocked, is taken care by a robotic CABG, and within 2 days, next 2 days, patient underwent a stenting procedure of another 2 vessels which are easily stentable through a normal angioplasty procedure via the right radial route.
So Dr. Amit did the stenting. That only took about half an hour maximum. It was very simple. I was awake. It was local anesthesia, and that went very well as well.
Patient recovered well, and she is almost walking 3 days post surgery along with the 2 stents.
On the 4th day of surgery, she was discharged home. She was walking from day 1, had very little pain. All her blood tests and echocardiography were repeated on day 4. All were found satisfactory. By getting a hybrid coronary revascularization procedure, she could get best of both the worlds. She got the benefit long term by getting a robotic assist CABG to left anterior descending artery, and the benefit of stent to the discrete lesion in right coronary artery and a diagonal branch. I wish her very good luck and healthy life for the rest of her life.
So I would just like to say big thank you, heartfelt thank you to all the staff members in Apollo that I came across. From the very first day, we were tended to with professionalism and humanity as well. People understood that we were going through a new thing, a new experience, can be a frightening one, so they made sure that we were comfortable, and not only were we looked after, but our family who are overseas were looked after as well, when news kept going back to them how I was progressing. So I'm very thankful, and I want to say thank you. And like we say in Fiji, to everybody here, including the attendants that looked after me. Thank you.